your forecast first. Sponsored by Matex Heating, Cooling, and Plumbing.
So we've got the cloud cover that has returned to the area, and you may notice some of the green showing up to the north. There is a warm front that's hanging across northern Illinois, and it's going to spark off maybe a few showers here tonight, mainly across our far northern counties. I wouldn't expect much for the vast majority of us. More than anything, it is just warm. It is 10 o'clock at night, and we're still in the 60s. 64 in Springfield, 60 in Champaign. And it's going to remain very mild tomorrow. I mean, look at this. In the morning, 56. By 10 a.m., you're talking 66 degrees and going even warmer than that. But thunderstorms return. We'll let you know when maybe some severe weather sets up when we come back. WCIA 3 News starts.
Now from WCIA 3 News.
Would like to extend our sincere condolences to the family and friends of this individual.
It's the first coronavirus-related death in Champaign County. What officials say makes a person more vulnerable than others. Fighting this virus means having access to ICU beds. How many are still available in Illinois and how quickly they could be filled.
We were starting this journey and thinking about bringing a child into the world.
But that plan did not involve COVID-19. How families and soon-to-be moms are adapting.
You're watching your local news leader. This is WCIA 3 News at 10.
People with these underlying conditions just aren't as capable of fighting it off.
As Champaign County reports its first death from COVID-19, we're taking a deeper look into what makes certain people more vulnerable. Good evening, I'm Jessica Coons. The Champaign-Urbana Public Health District says the man who died was in his 80s with an underlying health condition. Tonight we spoke with a doctor about compromising health issues that make it harder to fight off coronavirus. WCIA 3's Jennifer Jensen has that story.
The coronavirus is spreading and the death toll is reaching new levels daily.
It is with a heavy heart that I am here today to report Champaign County's first fatality due to COVID-19 infection.
This time, it took the life of a man in his 80s. While details of how he got the virus haven't been released, CUPHD says he had underlying health issues. There are several types of underlying conditions that make it very difficult to fight off coronavirus when it attacks the body.
Anybody 65 or older, someone with lung problems, so chronic lung disease like COPD or moderate to severe asthma, someone with bad heart condition, someone with diabetes, especially if it's not well controlled, people who have kidney problems that have to be on dialysis.
Dr. Robert Healy with Carl Foundation explains how some people's bodies aren't able to cope with the virus like a healthier person could.
It goes into people's lungs. That's where it attaches to the cells and the receptors and starts the process of infecting you. It puts a tremendous demand on your heart to pump more blood, get more oxygen into all the cells in your body. And if your heart is in bad shape to begin with, you're just not able to do that as well.
The stay-at-home order and the message of social distancing have been pushed out consistently for the past few weeks to slow the spread of COVID-19. Health officials say now is the time to do everything you can to prevent you, your family, and others around you from contracting this virus that has already killed so many.
Our public health recommendations remain unchanged in light of the sobering news. We encourage everyone to stay home as much as possible, and if you do not have to go out, please do not.
Reporting, I'm Jennifer Jensen, WCIA 3 News.
As of this afternoon, Champaign County had 63 confirmed cases, 8 people have been hospitalized, and 22 have recovered. Across the state, more than 12,000 people have tested positive. That's an increase of more than 1,000 since yesterday. 307 people have died. There's another coronavirus outbreak at a senior facility in Taylorville. This one is at Park Glen Apartments. 3 people there tested positive, and the complex is under a 2-week quarantine. Health officials don't know if this is connected to the outbreak at Rolling Meadows Senior Apartment Complex. 3 residents there have died. As Illinois hospitals race to rehire and cross-train staff to treat sick patients, one study suggests we may soon run out of places to put them. Capitol Bureau Chief Mark Maxwell spoke with hospital executives racing to create space in intensive care and to tech experts working to reduce overcrowding in the fight against COVID-19.
We are going to be filling up ICU beds across the state.
Illinois hospitals are bracing for a surge of patients who may need intensive care. But for many hospitals in rural downstate Illinois, that is an uphill battle.
There are critical access hospitals that may have fewer ICU beds.
Statewide, 70% of ICU beds were already in use at last report Friday, and 35% of those patients already sick with the coronavirus. The state plans to publish updated figures Tuesday. One University of Washington study projected Illinois could reach its breaking point in just 2 days, with more ICU patients than ICU beds available. But that study doesn't take into account the latest data from local hospitals who have already been in a race against time. Chuck Callahan is the president of the Memorial Hospital System.
We're using the time we have now before a surge would arrive to prepare.
When a COVID-19 cluster broke out in a Taylorville senior home, their critical access hospital took them in.
We're accelerating some renovation to get more beds in place, and certain units that don't act as intensive care units today, frankly, could be turned into intensive care units if the surge would require it.
The fight against COVID-19 requires manpower and brain power. OSF Healthcare turned to artificial intelligence to stem the tide of patients flooding their 14 emergency rooms in search of a test.
Based on how sick they project that patient to get, they can go in different pathways through the emergency department, and it also cues them and prioritizes them for the right resources in the hospital.
Even if Illinois reaches its peak, hospitals still have room to maneuver.
Either offloading the non-acute people who are in the hospital, the patients in the hospital, or we're providing additional facilities for people to have, ICU capability.
Reporting in Springfield, Mark Maxwell.
Memorial Hospital told us right now they do have enough ventilators, and if it comes to it, they are prepared to share the devices and put 2 patients on 1 machine. St. Anthony's Memorial Hospital in Effingham is temporarily closing its convenient care clinic. All outpatient services in the West Temple Avenue Health Center will stay open, but diagnostic services will only be offered on weekdays from 8 to 4:30, and the health center will be closed on weekends. Now for a follow-up on a doctor whose drive-through COVID-19 testing was postponed last week. He is suing the Champaign-Urbana Public Health District and its administrator, Julie Pride. Dr. Thomas Plura was going to do that testing at First Christian Church in Champaign, but the church postponed it under advice from health officials. Now Dr. Plura is filing a lawsuit under the Families First Coronavirus Response Act. That says patients have the right to a test if a provider is willing to give one. We have reached out to Public Health and are waiting to hear back. For more on the lawsuit and to see it yourself, you can go to WCIA.com. Blood centers are looking for anyone who has recovered from COVID-19 to donate plasma. Doctors say those people have developed antibodies that could help someone else fight it. Former COVID-19 patients looking to donate plasma need to be cleared by their doctor, and anyone who wants to donate needs to be symptom-free for at least 2 weeks before they can give. Some other news tonight, a man wanted for murder turned himself in today. Bryant Bunch was wanted for shooting and killing 36-year-old Devin Slater. It happened near the corner of Dennis and Wood Streets yesterday in Decatur. Police are still investigating but say this was not a random act and it is not believed to be gang-related. And a Champaign man was shot this afternoon near Bellefontaine and Market Streets. Police say a person on a bicycle rode up to the alley behind a house and started shooting. A 32-year-old man was shot in the leg and is expected to survive. No word on any suspects. Danville police are investigating after a teenager was shot last night near Franklin and Woodbury. They say the 18-year-old was standing outside of a party when it happened. If you know anything, you should call Crime Stoppers at the number on your screen. Are you pregnant and worried about having to give birth alone during this pandemic? What one hospital wants you to know. Plus, if you're wearing masks and gloves while you're out and about, then you should know how to properly use them so you don't contaminate yourself. And later tonight would have been the NCAA National Championship, and Coach Brad Underwood says there's a good chance the Illini would have been there.